Assalamu alaikum. Good afternoon. My name is Alaa Almealwi from King Abdulaziz University, Faculty of Engineering. Today I am going to talking about the point of care ultrasound and portable MRI. Course outline: Introduction to point of care ultrasound, clinical applications for point of care ultrasound, vision, introduction to MRI portable, clinical applications for MRI portable, visions, and conclusion. Introduction to point of care ultrasound. With the ever-changing landscape of healthcare delivery in the world, great efforts have been made to improve the speed and accuracy of diagnostic tests. Speeding up the drug process and time to diagnosis is critical to reducing morbidity and mortality in critically ill patients. Point of care ultrasound is one of the point of care testing tools available to the emergency physicians that answer specific clinical questions, knows difference, and guides clinical treatment. Therefore, ultrasound is defined in point of care as an ultrasound examination performed directly at the bedside by a healthcare provider to answer a specific diagnostic question or direct the performance of the surgical procedure. What is the difference between point of care and bedside ultrasound? There is a slight difference between them. Bedside ultrasound is an old term describing the ultrasound evaluation of patients, usually in a medical facility next to the patient's bed. As for ultrasound at the point of care, the patient does not need to move physically to the place of imaging. It includes many scenarios. For example, the patient may be examined in an ambulance or in the area of trauma applications of infusion pump. The clinical applications for point of care ultrasound: procedural guidance, diagnosis, monitoring, resuscitation, examination. Procedural guidance. It has been shown to reduce complications and improve success rates for bedside surgical procedures. The procedures typically performed with ultrasound guidance include vascular access, lumbar puncture. Diagnosis. Depending on the patient's signs and symptoms, ultrasound examination can narrow the differential diagnosis and direct treatment or further investigation, especially in urgent or emergency situations. Monitoring. Serial ultrasound examination can be performed to monitor a patient's condition or the monitor the effect of a therapeutic intervention without exposing patient to ionizing radiation or intravenous contrast. Resuscitation. The use of ultrasound during resuscitation of cardiac arrest is a unique but underutilized applications. Examination and ultrasound is likely to be beneficial because it is non-invasive and avoid ionizing radiation. Vision. Over the past 20 years, the use of point-of-care ultrasound has proliferated. We expect that nearly all healthcare providers, including nurses, advanced practice providers, and physicians, will use point-of-care ultrasound in their clinical practice over the next 10 years. Healthcare systems around the world strive to provide high-quality, effective healthcare. Point-of-care ultrasound can contribute to achieving these goals by reducing procedural complications and speeding up care, reducing the cost of additional testing, and reducing the use of imaging. Achieving these goals can advance the ultimate goal of improving patient experience and healthcare outcomes. Introduction to MRI Portable. The transition from hospital-centric diagnostic device, the portable diagnostic devices is as old as radiology itself. X-ray were discovered in late 1895 and used clinically within a year. It became a mobile imaging technology in 1914 when Marie Curie encouraged the development of a fleet of X-ray occupied ambulances for use in World War II to aid surgeons in field hospitals. Compared to 45 years after the introduction of MRI, we still lack a truly portable MRI machine. Here we define portable as a device that can be moved from room to room by a single nurse for use an individual patient within minutes of arrival. This contrasts with currently mobile MRI inside the track trails that required a road-detected power and cooling infrastructure with waiting at the new locations and at least the zones of hours of preparation before emerging at the new location. Note that there are also solutions between traditional and true portable solution where some special infrastructure is provided in the room. The clinical application and MRI portable equipment, altered acute mental state, convulsive movement, cerebral edema, cerebrovascular disease, cranial neuropathy, ventriculostomy evaluation, follow-up of intracranial hemorrhage, stroke follow-up of hematoma, tumor before and after the operation, walk-up stroke. And in the pediatric unit, it can be helpful in diagnosing condition related to altered acute mental state, head injury after a fall, stroke recovery, hypoxia ischemic encephalopathy, hydrocephalus. Vision. In this report, we emphasize that the challenges of achieving portable low-cost MRI are rooted in the insensitivity of MRI, which is typically addressed with high-field, highly homogeneous magnets. The size and complexity associated with such magnets creates barriers to cost reduction and operation as a portable device. In addition, issues arise from safety aspects of spurious fields, large gradient current and heat dissipations, and the need for compatibility with traditional office space, power, and cooling infrastructure. To achieve all this, the contemporary usage model may need to be re-examined where a single scanner is expected to process all MRI scans, though the goals becomes low-cost portable scanners that can achieve a useful range of clinical services, but perhaps not of all. Thank you for watching in this presentation. I will try to explain the basics in MRI portable and ultrasound equipment, and I hope I make a small benefit for other students. Thank you.